meeting for the Nepean riding. My name is Rick Baker. I'm president of CARP Ottawa, and it's my privilege and honor to serve as the host facilitator for today's session. CARP, or formerly known as the Canadian Association of Retired Persons, Ottawa, in collaboration with the National Association of Federal Retirees and the Ottawa Council on Aging, are pleased to work together to bring these all-candidate meetings to our respective memberships in the Ottawa area. I would like to acknowledge that the land where our three organizations are located is the traditional unceded territory of the Algonquin Anishinaabe people. Our goal is to provide the candidates within these ridings an opportunity to address key senior issues that have significant impact on our members. These key issues that we have collectively identified are the need for a coordinated national senior strategy, enforced principles and national standards for long-term care, and funding for home care. There are a few technical reminders to share with you before we move into our session. This virtual meeting is being recorded and will be shared with the candidates and those of you who have signed in to the session. We will not be having a question and answer period following the candidates' presentations, but you can send an email directly to the candidate. We hope you enjoy the session today, and it's one of 8 that is being hosted within the Ottawa ridings. As mentioned at the beginning of today's session, organized in collaboration with NAFR and the Council on Aging, I would now like to introduce Robert Giroux, who brings greetings for NAFR. Robert, please.
Thank you very much, Rick. Mon nom est Robert Giroux, and I am president of the Ottawa branch of the National Association of Federal Retirees. We are delighted to be working together with the Ottawa chapter of CARP and the Council on Aging to organize these sessions. Our association has a 50-year history and now represents more than 170,000 active and retired members of the Federal Public Service, the Canadian Armed Forces, the RCMP, and retired federally appointed judges, as well as their partners and survivors. In Ottawa, our branch has 33,800 members, and in the riding of Nepean, we have 2,632 members. As our members expect, our association puts special focus on protecting the pensions and benefits of federal retirees. We make sure that every government is aware if they are looking for cutbacks or savings, our association will vigorously protect the pensions and benefits that federal retirees have earned. Our Ottawa branch also focuses on education and information, particularly related to financial literacy and healthy aging. To keep our members and volunteers safe, we offer webinars over Zoom, and we offer these weekly, starting early in the fall session. We cover topics such as investing, downsizing, aging in place, staying fit at home, and many others. We invite everyone to learn more about our activities by visiting our website, NAFROttawa.com. Our association has 4 priority issues: retirement income security for all Canadians, a national senior strategy for all Canadians, universal public pharmacare, and veterans. Much improved support, care, and benefits for veterans. For today's events, the candidates were asked to focus specifically on a national senior strategy and the dire need for long-term care standards and reform, and the equally dire need to adequately fund home care. The pandemic has exposed the terrible issues that residents face in long-term care, and its effects are not yet over. According to the Ontario government website, over 41% of the COVID-19 cases that resulted in deaths between January 15, 2020 and September 2, 2021. And they were residents of long-term care home. That is why today we will all be listening closely to what the candidates have to say. We want to hear how your party if elected, will respond to this unprecedented situation. Merci beaucoup, Rick.
Well, thank you very much, Robert. Eloquently stated. And now I'd like to introduce Mr. Yves Leduc of the Ottawa Council on Aging to bring greetings. Yves?
Thank you, Rick. Bonjour. Good afternoon to all the participants on the Zoom meeting today. On behalf of the Council on Aging of Ottawa, I am pleased to welcome all the registered PARSIT participants who have taken the time to attend today's All Candidates meeting for the Nepean riding. As Rick pointed out, my name is Yves Leduc, and I have recently been appointed to the Board of Directors of the Council on Aging, and it is an honor to welcome both Matt and Chandra to this virtual All Candidates meeting. Unfortunately, other parties have not positively responded to the invitation. The Council on Aging of Ottawa is a bilingual, volunteer-based charitable organization dedicated to improving the quality of life of older adults living in Ottawa. We strive to promote and champion the basic tenets of an inclusive, caring city and the importance of community-wide engagement with a special focus on the vulnerable and isolated older adults.
Yes.
Concerns and issues of older adults are identified and solutions are sought through forums, research projects, and partnership networks. And this all candidate meeting is a good example of how our NAFR, CARP, and the Council on Aging can work together. I'd like to share a personal story here. Over the past 6 years, I have unfortunately lost my two parents. Both had transitioned from their house directly to a long-term care home where unfortunately they passed. My mother left us about 6 years ago, so well before the pandemic hit. Unfortunately, my dad was taken by COVID. I'm sharing this because that has allowed me to witness the lack of resources in long-term care home well before the pandemic hit. Dramatically, the pandemic has taken the life of many older adults, and it has worsened the challenges that healthcare workers have been facing for too long, such as lack of staff, lack of training, and lack of resources. The public in general was shocked by the situation, a situation that again existed well before the pandemic hit. So we need to move on, and let's hope those lost lives are not in vain. Let's stop pointing finger and let's become proactive in addressing older adults' concerns, starting with long-term care, where there is still an urgent need to provide appropriate care and appropriate financing. But the list, however, does not stop here. Think about housing, income security, social inclusion, transportation, only to name a few. All of those need to be acted upon, and to properly address them, leadership is required to come up with a solid and coordinated national senior strategy. So on behalf of the Council on Aging, I am therefore looking forward to what the candidates have to offer in response to these challenges. But moreover, beyond your party's platform on aging, I am interested to hear from both of you, Matt and Chandra, what you would do to help move these important issues forward if you are elected. Thank you very much, and back to you, Rick.
Thanks very much, Liev, and again, very well stated. As you can see, gentlemen, there are a lot of issues that affect seniors, and we've pinpointed 3 very key themes today. I'd now like to introduce our speakers for today. They've been provided with briefings and documentations and some of the key questions related to each of the 3 areas. They'll be given upwards of probably 10 minutes now because there's just the 2 of them, and each to present their particular party's platform and respond to some of the questions that have been pointed out to them. Should you go on a little too long, I will certainly give you a gentle reminder that time is just about up. So our first speaker today is Matt Teamstra, representing the Conservative Party of Canada. Matt, it's all yours. You just need to unmute yourself. There you go.
Perfect. Well, thank you so much for welcoming me today. It was an easy decision. We understand how much our seniors have invested, and I'm happy to speak to this group today. First, why don't I tell you a bit about myself? This is my first time running, so you likely have not seen my name before, and I just started really this journey in July. So I've had very little time, and of course, a quick snap election has made that a challenge, but we are up for it and our volunteers are out there. And why don't I just start with a bit of my biography? So I've been married for 17 years, which I know may not seem like a lot to many of your members. We have 3 kids. One of them is about to turn 16 and start driving. And frankly, I can just hear my own mother say to me that they just grow up so quickly, as I'm sure you all know. I think, but what is unique about our family in this context is that we also live in a multi-generational household. We tragically lost my dad about 10 years ago. He was only 52 when he passed away. But my mom, who is very introverted, actually found that she just hated living alone. It was very hard on her. I think she had her own issues with depression and anxiety. And what came of that was that we actually ended up buying a house together. So we pooled our mortgages. We were able to buy a bigger house to accommodate my family of 5 and my mom. She has a complete in-law suite, and it is great to see with her grandkids each and every day. The other benefit to this is that my wife loves to cook, and so she does all the cooking. And my mom actually hates to cook, always has. My dad was a self-employed painter, and so family mealtime was actually really precious to us. So we always had family supper at 6. But mom always hated cooking, but she always did it. But what is great about living together now is that my wife does all the cooking, and my mom is so grateful that she folds and puts away all the laundry. So it's certainly not what I expected as I approached my 40s, but I think it's a beautiful picture of multi-generational living. And of course, I'd love to have my dad back, but it's great that we have found, that peace and comfort of living together, and it just works out so well having my mom, live with us. And I think for us at the Conservative Party, that's one thing that's really important to us is we ask ourselves the question, how do we keep our seniors safely in their homes for longer? I think that we can see models that work, and I think that that's a great question we should be asking and being guided by. So we've done a couple things. We've put forward proposals to make the home accessibility tax credits, which is normally $10,000 per dwelling, and now we're going to change it to $10,000 per person to make these homes safe to continue living in. And we're going to allow seniors and their caregivers to claim the medical expense tax credit for home care instead of only allowing them to claim it if they're in a group home. And for families like mine who are living with an aging parent, we're going to introduce something new called the Seniors Care Benefit, and we're going to pay $200 per month per household to any Canadian who is living and taking care of a parent over the age of 70. We know it will make a really big difference to those living on tight budgets or strict incomes, and I personally know it will help my mom a great deal by the time she reaches 70. So that's just a little bit about my family, about what makes us unique. And certainly nothing makes me happier than when I see grandma on the floor with her grandkids. Of course, our youngest is 9, so there's not so much on the floor time, but we just love living together as a multi-generational family. As was stated in so many of the introductory remarks, we cannot have a discussion about how we support our seniors without talking about long-term care. That is something that we absolutely need to fix, and it's been a travesty. We know that our long-term care system needs to be fixed, and COVID has shown us the profound vulnerabilities in it. So a couple of things that we're going to do to address that. I think Canada's Conservatives are going to invite the provinces to work with us to develop a set of best practices for long-term care homes, things like national building codes that will provide guidance for provinces without intruding on their jurisdictions. But in the meantime, we need to update the infrastructure. And so we're going to devote $3 billion in infrastructure funding over the next 3 years to renovate long-term care homes across Canada. The other thing that really we noticed was that COVID showed us we just didn't have enough personal support workers, PSWs, those who every day did the hard work of caring for seniors living in long-term care homes, retirement homes, or even their own homes. So we need to invest in PSW. So we're going to provide immigration programs, and we're going to give favorability to those who want to immigrate to Canada, who already have those skills, and promote those careers through our immigration programs. I think as Canadians, we all watched kind of an absolute horror as we saw neglected seniors left to fend for themselves during COVID as it swept through long-term care homes, and who were shamelessly abandoned or neglected. And those people need to be held accountable, right? So we are actually going to provide stronger protection for seniors by amending the criminal code provisions on failing to provide the necessities of life to make clear that the operator of a licensed care facility should be presumed to have a legal duty to the residents of that facility. So we need more money for infrastructure, we need more PSWs, and we need a stronger criminal code. Those are just some of the things that we're going to do to try and fix long-term care home in this country. But I don't want to stop there, and there's so many other areas, that we can do to improve the lives of our seniors. I think one of those is doubling the Canada Workers Benefit to a max of $2,800 and paying it quarterly, not at the end of the year. And I think this will really help seniors who choose to continue working past retirement to give themselves a bit more income. We're also going to protect your pensions. You worked hard, those pensions deserve to be protected. We're going to change legislation to ensure that pensioners have priority over corporate elites in bankruptcy or restructuring. You paid into these, you rely on these pensions, but too often we see workers forced to take big cuts from their pensions when their companies go bankrupt. That's not acceptable. That needs to change. And it's time for government to stand up for workers and secure our pensions. I want to maybe, in the end of my remarks, I want to talk about affordability as well. I think we've all noticed that the price of everything is going up. Wages aren't necessarily keeping pace, and many of you are on a fixed income. Every time I put gas in my minivan, it costs $90, and that's going to continue to increase. Grocery prices are continuing to increase. And so how does a population whose wages aren't going up or who are on fixed incomes deal with that? And so I think on grocery prices, we've all heard about the price fixing schemes from a few years ago with bread. And there frankly just isn't enough teeth in the legislation and not enough of a penalty. So we're going to change that. When it comes to the price of gas, the carbon tax that was introduced by this government is going to make it so that gas continues to go up. So that's why one of the reasons why we're going to remove the carbon tax. We don't think that it should be on the backs of everyday Canadians to pay that. And we want to see those gas prices come down. And I think as well that COVID showed us the profound effects on our mental health and that we need to do better. I saw it with my kids, my 3 kids, and I know that seniors suffer through isolation as well. So that's why our government is going to treat mental health as health. But we're going to invest in the provinces. We're going to set up a suicide prevention hotline, and we're going to give incentives to employers to give better mental health benefits to their employees. I think maybe just to wrap up, I'd just like to say, I want to acknowledge the hard work and dedication by our seniors for making Canada the great country that we live in. And I think that beyond just issues specific to seniors, that so many of you care about the economy and the world we're going to leave behind for our own kids and grandkids. I worry about the current rate of spending in this government. In fact, it's more than every government before combined since Confederation. I think we need a government that is going to focus on Canada's economic recovery, which is why we need a conservative government. So I'm Matt Treemstra. I'm running in Nepean, both for my 3 kids, but also to support my own mother as she enters her senior years. I really hope that we are able to live together for many more years to come. Please, if you have questions, don't hesitate to reach out. As a candidate and as your future member of parliament, I will make listening and acting on your behalf my #1 priority. And I appreciate the organization of the 3 groups for putting this together. And frankly, you should never be caught off guard by your governments. And I'd be very open to open dialogue as we discuss these issues on an ongoing basis. We should not just be discussing this issue at election time. It should be an ongoing, every day kind of thing. And that's exactly what you're going to get from me if elected as your MP. So thank you very much. I appreciate the opportunity. I hope you got to know a bit about me, my family, and my mom. And I welcome any questions you guys might have.
Thank you, Matt. And I just love your passion. You tell such a great story, and best of luck to you in this upcoming election.
Thank you.
I just want to mention that I understand Gordon Kabinet from the Green Party has joined us. So Cheryl, I don't know if you can try to Zoom him in or not. Maybe reach out to him and let him know that we'd love to hear from him. Oh, there he is now. So, okay, great. Our second speaker is Chandra Arya. It's good to see you again, Chandra. Please explain the Liberal platform in terms of the 3 priority areas that we've talked about here.
Thank you, Rick. It's nice seeing you again. Thank you all who have organized this. Obviously, you know that this is nothing new to me. I have been engaged with the community and the organizations representing seniors and the retired persons. I was not a member of any political party 7 years back. 7 years back was the time I joined the Liberal Party. I joined any political party and I joined Liberal Party with three objectives. The two of those three objectives are directly related to seniors. The first objective is affordable housing for all. I was very clear that an investment of every dollar in affordable housing will save multiple dollars in other social costs, including the healthcare costs. The second objective was secure retirement, especially to 11 million working Canadians who don't have workplace pension plan. So I wanted to make sure that these 11 million Canadians who are working hard today, they have something secure when they retire. If not, most of them will directly retire into poverty. Because when the Canada Pension Plan and other stuffs they were first designed, they expected the workplace pension will account close to 70 to 75% of the retirement income. But substantial number of Canadians today are retiring without the workplace pension plan. And the third objective is for the future generation. I want to ensure that Canada will be at the forefront of the knowledge-based economy so that the prosperity, the standard of living that we enjoy today is available for our children and grandchildren. So these are the three objectives with which I came into politics. The moment I got elected in 2015, one of the first thing I did was join a group of MPs who are interested in the issues related to seniors. So we formed a seniors caucus in the parliament. So we have been passionately working on this issue from day one. In fact, many of the programs that we are seeing the government implemented during the last 6 years and the proposals we are coming out for the next 4 years is due to the work we, a group of MPs, we did for seniors. One of the first things we did was at a very macro level. We said issues related to seniors are so important. We cannot say that this is the issue of the municipality, nor the issue of the provincial government or federal government is responsible for a specific thing about the seniors. We said seniors issue has to be taken as a whole and we have to approach from that angle. So very first demand we made of our government to set up a special ministry, exclusive minister for seniors. And we did that. And that helped galvanize all the efforts across the government, all government of Canada approach into one single minister and help that minister to coordinate with the other levels of the government. Please note, this was done much before the pandemic hit. I'm talking of 2016, 2017. Again, before I entered politics, there was a study done for Ottawa and the Eastern Ontario region. I think 3 to 5% of the patients, again, 3 to 5% of the patients accounted for over 30 to 35% of the hospital expenses. So this small group of 3 to 5% accounting for about 1/3 of the hospital expenses was mind-blowing, which is not a surprise. In that small band of 3 to 5%, 50% were seniors, 1/3 people with mental illness. So again, much before the pandemic hit, I think in 2016 budget or 2017, I think 2016 budget, in addition to transferring the funds to the provinces for the healthcare, In addition to sending the usual top-up funds for the healthcare, we separately transfer the third tranche of funds close to $6 billion to provinces with two conditions: invest in home care, invest in mental illness. So these are the things that at the very macro level we started approaching 6 years before. And then we continued on, talking about the secure retirement. What many people don't know that we have reformed the Canada pension plan. Of course, we reduced the retirement age from 67 to 65. We started making progress into old age security. Of course, now we are also proposing for the increase in GIS, etc. But again, at the macro level, we created age well at home initiatives. Talking about the seniors, obviously, there are two groups of seniors: the seniors who have a bit of secure income and the seniors with very low income. So we did focus also on the people with low income seniors. We took certain measures. So going forward, obviously, we will continue with our move to increase the OAS by 10%. We will also increase the GIS by $500 to single seniors and $750 to the seniors starting to seniors couple. I have always been active on the seniors. In fact, twice I had brought the senior ministers to Nepean to discuss directly hear from seniors. That is we can hear from the bureaucrats, we can read from the reports, but there is no substitute from hearing directly from the seniors themselves. I remember when I first organized it, we thought only few seniors will turn up. So we had a room for 50 people. Within 24 hours, more than 75 people signed up. Then we increased. At the end of the day, we had a 250 room full of seniors interacting directly with the ministers. I am at the age of 58. I'm married for 31 years. I know I'm approaching close to joining your group one way or the other. And, I understand the issues. This pandemic has given a very good wake-up call, especially to long-term care. My parent, my father, or my wife's parents, they're not here. Both my father and my father-in-law got COVID. Thankfully, they have recovered. They're quite safe now. So we know that personally the issues that are affecting. As I said at the beginning, what we said at the macro level, we need at the national level a strategy. Obviously, we all love to have a well-defined national senior strategy. But one specific thing that we are promising is that we will be creating guidelines for all across Canada under the Safe Long-Term Care Act. I know my term is running short. I may have 1 minute left. Just to wrap up, all I ask you is, sometimes we can judge a person by one meeting. Sometimes we need interactions several times over a period of several weeks or even several months to judge a person. But many of you have seen me for the last 6 years. You have seen me in action. You have talked to me. You have emailed me. You had discussions with me. You have seen me working. So judge me based on what I was during the last 6 years, how I interacted with you, how I acted on the issues related to seniors. Based on that, look at me and then pass your judgment. Thank you so much again for welcoming me here. I will be around here anytime you need anything. Thank you.
Well, thank you again, Chandra. And again, I appreciate all of your hard work that you've done over the last few years. And I know we're able to move a number of senior issues forward. So we appreciated all the work that you've done. And again, good luck to you in the upcoming election. We've now been joined by Gordon Kubanek. And Gordon, I don't know if you're coming on a Zoom or by phone. So
I'm on Zoom.
Okay, so you want to open your picture so we can see you?
switch to computer audio. Usually this happens by itself. I don't have a video control at this end.
Okay, well,
I've not been given video control.
I'll give Cheryl that responsibility, but at least we can hear you, sir. So
Yeah.
would you like to tell us who you are? And you're representing the Green Party. So
Yeah.
Please move forward with your remarks.
Great, thank you very much. So my name's Gord Kubinek. I've been a candidate for the Greens since 2007 in Nepean Carleton or Carleton, and now back in Nepean. I have been an engineer and then a high school physics teacher. I'm happily married. I do this because I got very sick in the early 2000s from a virus, which put me on the floor for a couple of years. I had a lot of time to think about what matters. And I decided that my kids and their future mattered more than anything else. And my job was to help create a future for them. I was strongly influenced by an older gentleman when I lived in Pennsylvania, where I taught. And he had this whole idea that the task of the older people in itself, at the time that meant him, was to leave a legacy for the next generation. So the work that I do is really to lay a foundation for the future. And so it's less about me, but me being supported so I can then in turn support others, sort of like an elder. I really like the Indigenous concept of the elder sharing their wisdom. It resonates with me. A little bit about me. I wanted to first congratulate Matt on his having his mother living with him. I think that's wonderful. And a lot of what he said was supporting the conservative platform to support people being at home, I think is a great idea. I'm very supportive of that. By the way, part of the Green thing is we don't want to ever denigrate the other parties. We recognize each of us has something to contribute of value. So I want to congratulate Matt on that. I do want to make one minor correction. Obviously, I'm mostly with the Greens because of the environment, which really includes the social environment. And minor correction, his leader does now support a carbon tax of $20 per ton. I know many members of his party don't support that, but the leader does. I want to also give a congratulations to Chandra. I know he's been doing great work, and indirectly, sort of through the wonderful multiculturalism we have, I've been inspired by many families from India. I've been doing a lot of tutoring, and I've had many families from India that I've tutored in Barhaven, and they were all 3-generation families. All of them had their kids and their parents living with them. It really inspired me. So I've done the same thing like Matt. I have my mother, but also my mother-in-law live in our house, and we made modifications with stair lifts, etc. I really think that it's incumbent that governments support families to do that, but I also think there needs to be a change of values among Canadians. Most people I've talked with, when I describe what we've done, whether they're younger or older, don't want to do that. It's extremely rare. There's sort of this cultural value of sort of I would call over-ranked independence, rather than saying, we all need each other. So I think it's not just a money thing. It's, how do we talk to each other and think about each other, that we're all in this together and we're better off when we support each other. So that's sort of my personal story. And it's been really a great challenge, but interesting as well to live with seniors. In terms of the Green Party and their policy, we support universal pharmacare and universal dental care. Certainly I know for myself, because of my weakened heart from the virus, I have several $100s of bills for pills. I'm lucky to have a good private health insurance plan, but without those meds, I wouldn't survive very long. And I think everybody deserves that. Another part, and I know the Liberals have been working on that, but I think this is a must to not just talk about, but do, is all the people who are on contract work and temporary work be part of the Canada Pension Plan. I know there's work being done on that, and the Greens would like to be part of that to make sure it really happens. Because once again, with the younger people, they're not being able to contribute because there's so much temp and contract work out there, and they need to be part of the Canada Pension Plan, so they're taken care of. This is maybe a sort of a tangential issue, but I think it's related in that there's a question of disabilities. I have several good friends who are in disability. They earn only just over $1,100 a month, which is pretty criminal when you consider the CERB is $2,000, and that was considered a base. And when they get their pension, it's actually taken away from them. I realize that disability is provincial, but they can work with the federal government to make sure when their CPP gets kicked in, that it isn't taken away from them. So they're magically supposed to work on $1,100 a month, which any reasonable person knows is absolutely impossible. Another thing that I want to now put a little bit of a different flavor where the Greens are coming from. We have a very much of a long-term perspective on any issues. And one of the things that is near and dear to our heart are ideas like the difference between a lifespan and a health span. And a lot of our challenges in Canada are happening because Canadians are living longer, but more of those years they're sicker. So they need more and more care. So our focus would be, in a way, is very much of a focus on prevention. So how can we have seniors be healthy and active so that their lifespan is also got a health span, so they coincide, so they're still active. And we know, I know from the fact that I'm part of a longitudinal study on healthcare that a significant part of health is mental health and emotional health and connections. So once again, seniors living with other seniors, living with together in some co-housing or with their family, I know it is a great improvement on mental health and therefore health. The last little bit I want to talk about is the death rate that happened because of COVID in Canada versus elsewhere, the problems with our long-term care facilities. I've got some numbers from some recent reports, and very simple in terms of the death rate during COVID. The for-profit homes, the death rate was 23 per thousand, and in the publicly owned houses, it was only 5.8. So a factor of over 4 in the private houses. So we certainly have a problem with our privately funded long-term care facilities. Those numbers, by the way, are from British Columbia. There's some other problem with for-profit, unfortunately, is that when they spend less of their revenue on direct care. So under 50% of the revenue is spent on direct care for the seniors. The rest of it is overhead. While in the nonprofits, it's almost 60%. The wages for the people working there are much lower, approximately $7 per hour lower in the for-profit long-term care facilities. And in the case of the for-profits, any profits they make, of course, go to the investors, and the smaller surpluses in the nonprofits is all reinvested in the facilities. So there's really some significant problems we have with the for-profit system. I'm not saying get rid of it, but I'm certainly saying that we need to create some structures within which, so we don't have these big differences in revenue spending and the pays of the people working there as well. The result of all that is that when the COVID hit, in terms of, if we compare ourselves to other industrialized countries, Canada had 81% of our COVID deaths were for residents of long-term care facilities. The average in OECD countries with only 38%. So we had over double the percentage of the victims of COVID who were seniors, and it directly relates to our long-term care legislation structure and how we spend money. And so we do have some serious work to do. I do agree with Matt that part of it is family taking care of family, but we can only do that so long. And then we have to help those like my mother and my mother-in-law to find a place to live. I hope that's given you a sense of what the Green Party is like. And as you vote, of course, I have as teacher, so for me, what's near and dear to my heart is our grandchildren. And what we're really voting for is we want to have a good life, but really it's a legacy for our kids. So I hope that we can all vote, not only for ourselves, that we also vote for our grandchildren so they can have as good a life as we've all had. Thank you for your time.
Well,
All the
thank you,
best on
Gordon,
election day.
and I really appreciate your personal stories, and it's amazing some of the statistics that you're sharing with us today. Gentlemen, we have a few more minutes, so I'm just going to ask each of you if you'd like to add another 2 minutes worth of your key thoughts, obviously on the 3 priorities that we talked about, but if there's any other specific item, please let us know. So Matt, we'll start with you again in 2 minutes.
Great. Well, what a great forum to hear from all 3 candidates. It's rare in politics that we are given more time. It's usually less. And there's usually debating back and forth. So I just appreciate the opportunity to be heard. I appreciate the collaboration of your 3 organizations working together. And if you're doing 8 of these, that is no shortage of work on your behalf. So thank you for what you're doing to make sure that the issues of seniors are heard. For us, I could just reiterate all of our platform commitments. They're all there. They're all in black and white. I invite you to look at them. You can check out my website to learn more about our plan, to learn more about me. We simply have to take care of the generation that built and created Nepean. And when we're going to do that by keeping seniors in their homes for longer safely, we have to address long-term care in this country. Conservatives have a plan, and issues that affect all of us, regardless of age, like our mental health, like affordability, like housing, affect us all, including this demographic. And so I think all of those things, the Conservative government has a real plan on, one that I'm looking forward to implementing. I don't have a track record being a first-time candidate, but I am looking forward to working closely with all of these groups as we move forward, starting day 1 after I get reelected. And so I will just end by saying thank you. We appreciated the time, and I'm always available by email and phone if anybody has any questions for us.
Well, thanks again, Matt, and good seeing you today. Chandra, a couple comments, please.
Thank you, Rick. I'm glad that the multi-generational living together issue came up. That is obviously, we have experience on it. One of the things I did not mention earlier is not only the proportion of seniors is increasing, we also have to recognize the wealth that we have amongst the retired professionals. The knowledge, expertise that they have gained over a period of decades of building Canada, that is available almost free most of the time. Knowledge is defined in 2 ways. One, that what we know ourselves. Second, we know where to find it. And one of my first go on most issues is to the seniors who have worked in different fields. And we want that knowledge and expertise be available to Canadians. That is the reason why we have doubled our investment to New Horizon program for seniors. This is a program which is inspired, led, and managed by seniors for not just other seniors, but to the community and many times to the younger generation too. So those are the kind of things that we are moving in. That's how we can keep the seniors engaged, and that's all we can continue to benefit out of their long-held knowledge and expertise. Thank you so much again for inviting me here. It's always a pleasure to interact with you all, guys. Thank you.
Thank you, Chandra. And Gordon, are you still with us?
Yes, I am.
Okay, a couple
Great.
more minutes.
Yeah, so I'm going to come at this from a slightly different tact. Because I was very sick and was sort of at my death's door a while back, I really had this feeling that regret really overcame me about, there's things I wanted to do, there's a life I wanted to leave, there's something I wanted to transfer that wasn't happening. So I'm really recommending for all of us when we're older to think about what is the legacy we want to leave. So we've had a good life. Hopefully we're not alone. I mean, I agree with the things to make sure that seniors are taken care of with dignity, that they are connected, that they're valued. If we can think of ourselves more as respected elders, and it's like, what can we transfer to the next generation so they can continue to live the high quality of life which most of us experienced? Because we've had the biggest boom time ever since World War II. We've had more wealth generated than any time in history, which has benefited us, but we want to continue that so our grandchildren can do it. So come election, I challenge you to think, talk to your kids, talk to your grandchildren, what are theirs, so that you become the respected elder, that they listen to you with your wisdom, with your insights about life. But to do that, we have to listen as well, and then vote for your grandchildren so that you take care of them and then they'll take care of you, because we all need to take care of each other. Thank you.
Thanks again, Gord. Well, thank you again, gentlemen, for your time today. Certainly, as I said earlier, I see the passion, the dedication of the work that you do and are proposing to do. We can only wish you the very best in terms of the upcoming election, and good luck to all of you. Following this session, to our members, they will be sent a brief evaluation to let us know how we did today. And again, we invite all of you to join in our third all candidate meeting scheduled for Monday, 10 o'clock, hosted by the Council on Aging. Most importantly, we encourage members to get out to vote. And Elections Canada has important directions as to how to carry out your vote in your respective riding. Remember, seniors traditionally get out to vote, and we can make a difference. And again, on closing, I also want to thank Robert Giroux and Yves Leduc for joining us. Thanks again, folks, and we will see everybody in another time. Well done.
Thank you.